Welcome, everyone, and thanks for joining us for thyroid eye disease, new results from a GDATF-Commissioned patient survey. My name is Kimberly Dorris. I'm the Executive Director of the Graves' Disease and Thyroid Foundation, and I'll be joined today by Dr. Nancy Hord Patterson, who is the founder of the Graves' Disease and Thyroid Foundation. We'll be talking today about results from a thyroid eye disease patient survey. This was an online survey commissioned by the Graves' Disease and Thyroid Foundation. It consisted of 62 questions. The majority were multiple choice, but there were 3 free-form questions included that allowed for narrative responses. The survey was open from June of 2022 through July of 2022, and 443 responses were received that met the inclusion criteria for the survey. And we go into a lot of detail on this in a prior webinar. And I will include a link to that in the description for this YouTube webinar. This project was funded by an educational grant from Amgen, formerly Horizon Therapeutics. The sponsor was not involved in the study design, collection, analysis, interpretation of data, writing of the original publication article, or preparation of this presentation. A portion of the survey responses were incorporated into a peer-reviewed published article called How Patients Experience Thyroid Eye Disease. And I will also add a link to this paper in the YouTube description because we would encourage everyone to go back and read that original paper. The survey collected more data than would fit into one single paper and one single publication. How Patients Experience Thyroid Eye Disease focused on demographic data, time since diagnosis, symptom burden, and quality of life burden. We received hundreds of narrative responses, which the Graves' Disease and Thyroid Foundation has collated by category, and we posted on our website. You can go to GDATF.org, find the resources tab, and click on TED Survey 2022 to 2023. So this webinar is highlighting some all-new results that were not included at all in that original paper, and we will provide the citation for this webinar in the YouTube description. So kindly give the Graves' Disease and Thyroid Foundation a shout out if sharing this data. So the full limitations to the survey project were discussed in the Frontiers in Endocrinology paper, and also in our prior webinar, but just to highlight a few, the survey was only available online. It was a self-selected population, and the survey population was 83% white, 82% based in the USA, 73% age 50 and older, and 91% female. Also, a couple things that are relevant for our talk today. There were no questions asked regarding smoking status, and the TED activity level was self-reported, not backed up by medical records, and it was captured at the time of the survey, not at the time the treatment was delivered. So we will tackle this new data from 2 different angles. First, we'll look at all of the treatment options, and then focus on which of the symptoms were improving using those treatment options. And then we will flip it and take a look at each symptom that we look at and say which treatment options were perceived by the patients as being most helpful. And these were the treatment options we asked about in the survey. There were 3 that received few or no responses, so we will not be discussing those today. Those are Rituxan, Actemra, and Cellcept. But today we'll be discussing eye drops, oral steroids, IV steroids, selenium, Tepezza, orbital radiation, orbital decompression, strabismus surgery, and eyelid repair surgery. The questions were structured in a specific way. For each of the treatment options, we asked a cluster of 3 questions. First, we asked, have you used this treatment to treat TED? And the options were yes currently, yes in the past, no, and not sure. And if they said yes currently or yes in the past, that brought up 2 additional questions that were basically part A and B of the same question. We asked, how did or does this treatment options affect your symptoms? And we asked about 1 cluster of symptoms. And then we asked, how did or does the treatment option affect your symptoms? And that was a cluster of 6 additional symptoms. And those options were not applicable, I didn't have the symptom, seems worse, seems unchanged, or seems better. And these are the symptoms that we asked about. Symptoms 1 to 6 were double vision, blurred cloudy vision or vision loss, color vision loss, sensitivity to light, pressure pain around or behind the eye, dry gritty eye, and that was the first cluster. Symptoms 7 through 12 were tearing, eye redness, bulging eye, inability to close the eyelid swelling, and eyes pointing in different directions. So now that you've seen the structure of those questions, some additional limitations that are relevant, seems better measured the patient's own subjective view of their symptoms and not specific measurements of, for example, how many millimeters of bulging you had in the eye, or a scoring system like VISA that stands for vision, inflammation, strabismus, and appearance, and is done by a qualified medical expert. It's also important to note that symptoms typically change over the course of thyroid eye disease. You have a period of worsening, and then towards the end, there may be some improvement in symptoms. So it can be a little bit difficult to sort out what's just the normal course of thyroid eye disease and what's the treatment option. And then finally, it's difficult to isolate the treatment of one single option when there are options that are being used simultaneously. For example, orbital radiation is often delivered with IV steroids. You can take selenium or use eye drops while you're going through any of the other treatment options. So it can be a little hard to parse out which option is bringing the symptom relief. And just to highlight how a lot of patients need multiple treatment options to deal with the various symptoms of thyroid eye disease, we'll share a few of the narrative comments from the survey. I have had everything done, 9 muscle surgeries and orbital decompression and radiation twice. I have accepted that my eyes will never change. I have had everything done and know this is my vision, my eyes, and nothing else can be done. I have already had 3 decompression surgeries. They helped. I have had Tepezza, but would not mind doing it again. I have also had several lid retraction surgeries. My eyelids still do not close, even after 4 surgeries. Currently going through round 2 of Tepezza and already had thyroid removed, radioactive iodine ablation on remaining remnant, 12 rounds IV steroids, oral prednisone, 4 eye surgeries, and antibodies remain high. Very frustrating. In the beginning, I had 11 surgeries in 18 months. I got fed up and still have double vision all these years later. So before we jump into the results, I would like to bring in Dr. Nancy Hord Patterson for some additional commentary on her personal experience with thyroid eye disease. But first of all, Nancy and I showed up this morning not knowing with matching green mugs. So welcome, Nancy. Thanks for being here today.
Thank you for having me.
So first of all, could you share a little bit about your own personal story with getting diagnosed with thyroid eye disease?
I'd be glad to. One thing you have to understand is I was diagnosed a long time ago. It was back in the last century. It was 1987. And I was driving home one day from somewhere. My heart started pounding to the extent that I could see my shirt bouncing up and down. I'm a nurse practitioner, and I had just finished my Ph.D. And part of me said, "Oh, you must be under a lot of stress." And the other part of me, the nurse, said, "No, you need to go see a cardiologist." And I listened to her, and I had a cardiology appointment the next week. It was easier to get appointments back then. And he tested everything cardiology wise and said I did have some fast heartbeats, but it was okay. He asked me to wear a heart monitor and come back. There was one more test he wanted to do. And I didn't say anything. I'm a lot more assertive now than I used to be. Heart monitors back 30 years ago were the size of laptop computers. And I was in private practice, and I wasn't going to wear a laptop computer on my chest. while I'm trying to talk to people about their emotional problems. So rather than telling him that, I went to another cardiology group who waited around for a long time before they decided maybe they should do a TSH, and they immediately referred me to an endocrinologist. This referral came after I literally passed out on the treadmill that they were testing me on. And they did do a TSH and sent me to an endocrinologist who told me I had hyperthyroidism. He didn't use the word Graves' disease. And that there were 3 treatments. I could have surgery, which I couldn't. He told me I would not be able to talk anymore because surgery 30 some odd years ago was very, very crude. Nowadays, it's very specific. They have cameras, they can see what they're doing. He said that if I took the anti-thyroid drugs, I might get leukemia. He did not say leukopenia, which I know the difference in, but he said I could take radioactive iodine, which was 100% safe. So that Friday I had radioactive iodine. Learned later that they did some studies and found out that radioactive iodine could trigger thyroid eye disease. At the end of that, the next week after I took the RAI, I went back to see my regular doctor, and he said, "How are you feeling?" I said, "I feel okay, but my eyes feel funny." He gave me a referral to a local ophthalmologist who saw me within a week. And I'm pressing these time things because that still doesn't happen. You hear people say, I went for weeks and months and years before I got a diagnosis, and I couldn't get an appointment, and et cetera. This doctor told me that I had Graves' orbitopathy. They hadn't started calling it thyroid eye disease yet. He told me that it would be an active phase for up to 3 years, and then it would be an inactive phase. That my eyes looked like they were going to swell up, but they would either go back down or stay that way when I got to the inactive phase. But at that point, there was surgery that could fix it. He said, "We have no treatments. The glories about today are we have treatments. You don't have to wait and do a lot of the stuff that most of us have done." And the take-home point for me on that is I didn't know anybody that had Graves, and I have, in these 30 some odd years, I've had one person tell me that they knew somebody that had Graves' disease and thyroid eye disease. We all enter this arena very much alone, and that shouldn't be happening now. We need to teach the doctors to tell us more sooner. And with that, I'll be quiet.
No, that was great. I do want to go back to what you mentioned about leukemia. So that is not a known side effect of methimazole. That was the doctor using an incorrect term, or or something like that. But there are side effects to methimazole, but leukemia is not one of them. All right. Thank you, Nancy.
Mm-hmm.
A few notes on data presentation. We are focusing on the seems better responses for each individual symptom, and the not applicable, I didn't have the symptom responses have been removed from the denominator, because as a patient, it made more sense to me to say, out of the people who actually had this symptom, what percentage got better when they tried this treatment option or that treatment option. So to start off, we'll focus on each of the treatment options and see which of the symptoms that we asked about were perceived by the patients as improving. So we had 280 patients in the survey who had used eye drops, and so responded either yes in the past or yes currently to how did or do eye drops affect your symptoms. 56% of those patients said that dry, gritty eyes improved with eye drops. 39% said their redness seems better with eye drops. 32% tearing. 32% blurred, cloudy vision or loss of vision. 24% pressure and pain. 24% double vision. 16% inability to close the eyelid. 15% eyelid swelling. 15% bulging eye, 14% sensitivity to light, 11% color vision loss, and 9% eyes pointing in different directions. We had 128 patients who had used oral steroids. Out of those, 43% said their pressure and pain seems better, 31% said redness seems better, 30% eyelid swelling, 29% double vision, 29% bulging eye, 25% dry gritty eyes, 24% blurred cloudy or loss of vision, 21% sensitivity to light, 21% inability to close the eyelid, 20% tearing, 17% color vision loss, and 10% eyes pointing in different directions. Out of 63 patients who had used IV steroids, 50% said their bulging seems better, 47% said their pressure and pain seems better, 47% eyelid swelling seems better, 46% double vision, 42% blurred cloudy or loss of vision, 40% tearing, 39% redness, 36% inability to close the eyelid, 35% sensitivity to light, 33% dry gritty eyes, 25% eyes pointing in different directions, and 22% color vision loss. 159 patients had tried selenium. 18% of those said that selenium made their redness seem better. 18% said their pressure and pain seemed better. 16% dry gritty eyes, 15% tearing, 13% eyelid swelling, 13% sensitivity to light, 13% double vision, 13% bulging, 10% blurred cloudy or loss of vision, 9% inability to close the eyelid, 3% eyes pointing in different directions, and 2% color vision loss. 51 patients had used or were currently using Tepezza. 65% of those said that their pressure and pain seemed better. 63% said their bulging seemed better. 62% eyelid swelling, 58% dry gritty eyes, 56% tearing, 56% redness, 51% inability to close the eyelid, 45% sensitivity to light, 44% double vision, 42% blurred cloudy or loss of vision, 27% eyes pointing in different directions, and 13% color vision loss. 33 patients had or were undergoing orbital radiation. Out of those, 52% said their pressure and pain seems better, 50% said their bulging seems better, 48% said their eyelid swelling seems better, 41% blurred cloudy or loss of vision, 41% eyes pointing in different directions, 38% double vision, 35% sensitivity to light, 33% redness, 33% inability to close eyelid, 32% tearing, 27% dry gritty eyes, and 26% color vision loss. 89 patients had orbital decompression. 92% of those said their bulging seems better. 78% said their pressure and pain seems better. 75% said their inability to close the eyelid seems better. 60% eyelid swelling, 59% dry gritty eyes, 54% redness, 49% tearing, 48% double vision, 46% blurred cloudy or loss of vision, 37% sensitivity to light, 33% color vision loss, and eyes pointing in different directions, 32%. 66 patients had strabismus surgery. 83% of those said their double vision seems better. 75% says eyes pointing in different directions seems better. 42% bulging, 41% blurred cloudy or loss of vision, 36% pressure and pain, 33% inability to close the eyelid, 31% eyelid swelling, 29% redness, 27% dry gritty eyes, 26% sensitivity to light, 25% tearing, and 19% color vision loss. 89 patients had eyelid repair surgery. Out of those, 70% said the inability to close their eyelid seems better. 50% said their dry gritty eyes seem better. 45% bulging, 44% redness, 43% eyelid swelling, 40% tearing, 37% sensitivity to light, 32% pressure and pain, 30% blurred cloudy or loss of vision, 29% double vision, 21% eyes pointing in different directions, and 20% color vision loss. So next we'll kind of flip that, and we're going to go through symptom by symptom and look at which treatment options were perceived. Again, this was the patient's own kind of self-perception, were perceived as being helpful. And again, just a reminder of the symptoms that we asked about. And this data is from the original paper and was mentioned in our prior webinar. This was the percentage of patients who said that specific symptoms had bothered them the most in the last 2 months. And by bothered you the most, we specifically said were causing you pain and suffering or had created life difficulty. And we will go through these in the order from the largest percentage of the survey group who had that particular symptom down to the smallest percentage, which 2% were experiencing color vision loss. So 65% of patients said dry, gritty eye had caused pain and suffering and life difficulty in the last 2 months. 59% of those said their dry, gritty eye seems better after orbital decompression. 58% said their dry, gritty eye seems better after Tepezza. 56% eye drops, 50% eyelid repair surgery, 33% IV steroids, 27% strabismus surgery, 27% oral radiation, 25% oral steroids, and 16% selenium. 56% of our survey group said light sensitivity had caused pain and suffering or made their life more difficult in the last 2 months. 45% said their light sensitivity seems better on Tepezza, 37% with orbital decompression, 37% with eyelid repair surgery, 35% each orbital radiation and IV steroids, 26% strabismus surgery, 21% oral steroids, 14% eye drops, and 13% selenium. 43% of our survey group said eye bulging had caused significant pain and suffering or life difficulty in the last 2 months. And 90% of those patients who received orbital decompression said their eye bulging seems better. 63% of Tepezza users said their eye bulging seems better. 50% IV steroids, 50% orbital radiation, 45% eyelid repair surgery, 42% strabismus surgery, 29% oral steroids, 15% eye drops, and 13% selenium. 42% of our survey group said pressure and pain caused pain and suffering and life difficulty. And out of those, 78% who had had orbital decompression said their pressure and pain seems better. 65% who had had Tepezza said their pressure and pain seems better. 52% who had had orbital radiation said their pressure and pain seems better. 47% IV steroids, 43% oral steroids, 36% strabismus surgery, 32% eyelid repair surgery, 24% eye drops, and 18% selenium. Tearing caused pain and suffering and life difficulty for 41% of the patients in our survey group. 56% said their tearing seems better with Tepezza. 49% said their tearing seems better with orbital decompression. 40% IV steroids, 40% eyelid repair surgery, 32% orbital radiation, 32% eye drops, 25% strabismus surgery, 20% oral steroids, and 15% selenium. 39% of our survey group said redness had caused pain and suffering or life difficulty in the last 2 months. Of those, 56% of the patients who used Tepezza said their redness seems better. 54% said their redness seems better after orbital decompression. 44% eyelid repair surgery, 39% eye drops, 39% IV steroids, 33% orbital radiation, 31% oral steroids, 29% strabismus surgery, and 18% selenium. 35% of the survey group said that double vision had caused pain and suffering or life difficulty in the last 2 months. Of those who had strabismus surgery, 83% said their double vision seems better. 48% who underwent orbital decompression said their double vision seems better. 46% IV steroids, 44% Tepezza, 38% orbital radiation, 29% oral steroids, 29% eyelid repair surgery, 24% eye drops, and 13% selenium. 33% of our survey group said eyelid swelling had caused pain and suffering and life difficulty in the last 2 months. Of those, 62% of patients who used Tepezza said their eyelid swelling seems better. 60% who underwent orbital decompression said their eyelid swelling seems better. 48% orbital radiation, 47% IV steroids, 43% eyelid repair surgery, 31% strabismus surgery, 30% oral steroids, 15% eye drops, and 13% selenium. 32% of patients said blurred, cloudy vision or loss of vision had caused pain and suffering or made their life more difficult in the last 2 months. 46% of those who underwent orbital decompression said their blurred, cloudy vision or loss of vision seems better. 42% IV steroids, 42% Tepezza, 41% orbital radiation, 41% strabismus surgery, 32% eye drops, 30% eyelid repair surgery, 24% oral steroids, and 10% selenium. 21% of our survey group said inability to close the eyelid had caused pain and suffering or created life difficulty in the last 2 months. Of those, 75% who underwent orbital decompression said their inability to close the eyelid seems better. 70% who underwent eyelid repair surgery said their inability to close the eyelid seems better. 51% Tepezza, 36% IV steroids, 33% orbital radiation, 33% strabismus surgery, 21% oral steroids, 16% eye drops, and 9% selenium. 16% of patients said eyelids pointing in different directions had caused pain and suffering or created life difficulty in the last 2 months. Of those, 75% who underwent strabismus surgery said the issue seemed better. 41% for orbital radiation, 32% for orbital decompression, 27% for Tepezza, 25% for IV steroids, 21% for eyelid repair surgery, 10% for oral steroids, 9% for eye drops, and 3% selenium. And this is the last of the symptoms that we'll go through. 2% of the survey population said that color vision loss had caused pain and suffering or life difficulty in the last 2 months. And again, this is a medical emergency. If this happens, call your doctor immediately. Of those with color vision loss, 33% said their color vision loss seemed better with orbital decompression, 26% with orbital radiation, 22% IV steroids, 20% eyelid repair surgery, 19% strabismus surgery, 17% oral steroids, 13% Tepezza, 11% eye drops, and 2% with selenium. So this concludes the section around symptoms and treatment options. We have some additional questions that were asked in the survey that were not covered in the original paper. We asked, if possible, which treatments would you like your doctor to implement? And they were able to select up to 3. 39% said, I don't know. 21%, none of the above. 17% eye drops. 17% eyelid repair surgery. 15% Tepezza. 8% orbital decompression surgery. 8% selenium, 6% oral steroids, 5% strabismus surgery, and the remaining treatment options were less than 5%. We also asked the survey participants if their most recent set of labs, if the results were either too high or too low. And 15% of the survey group had a TSH that was too high. 16% said TSH was too low. 8% said free T4 was too high. 4% that free T4 was too low. 5% said free T3 was too high, and 4% said that free T3 was too low. 11% said TSI was too high. 8% said TRAB was too high. 4% TPO antibodies were too high. 22% were not sure if anything was too high, and 21% were not sure if anything was too low. 48% responded none of the above were too high. 58 responded none of the above were too low. And I skimmed over the antibodies being too low because you really can't have antibodies that are too low when we're talking about Graves' disease and thyroid eye disease. You want them to be low. With that, we will bring back Dr. Nancy Hord Patterson. Welcome again, Nancy.
Thank you.
So you mentioned that you had limited options at the time that you got diagnosed. Could you go through the options that were offered to you when you got diagnosed with thyroid eye disease?
At the time I was diagnosed, the options were elevate the head of your bed, ice packs, eye drops, occasionally a diuretic if the swelling just got too bad. But again, the emphasis on we don't have any treatments. We have things that we could try to manage it with. We've talked about when I started on oral steroids. I probably had some back then. I had them periodically for several years, just as the last minute go-to. And they helped for a while, but they didn't last. The treatments that the list of treatments that you have has lots of treatments that had not even been dreamed of. By now we're up to 1990. I'm in the inactive phase. I had orbital decompression, which worked great. My eyes weren't bugging out what felt like to the end of my nose. It wasn't quite that bad, but they were. I then had upper eyelid surgery just to help my eyes close. I guess it wasn't successful because to this day, my eyes don't close all the way. That's one reason I have such a problem with dryness. I also had strabismus surgery, which I loved because it helped a great deal. They talked about doing it again to make it, absolutely perfect, but I wore glasses anyway, and I had prisms in them, and it was like, I don't mind the prisms. They work. So the strabismus surgery worked and continued to work. The decompression worked and continued to work. Over the years, I've had a lot of eyelid trying to adjust things, and they haven't worked for a number of reasons. Just we keep trying. You've mentioned somewhere about labs being stable. Mine have been very stable, and when they would get a little out of whack, the doctor would say, ordinarily we'd change your dose, but with you, I want you to quit taking, say, the Synthroid for 2 weeks and then get back on your regular dose. And that always worked. So overall, 99% of the time, my labs have been stable.
So were you cycling hyper?
Yes.
And that was causing symptoms, and then so they were saying stop your Synthroid and then we'll recheck levels?
Yes.
Okay.
And they did recheck them very quickly.
Okay.
Over the years,
just to clarify, you weren't saying just randomly stop your Synthroid for 2 weeks and see what happens. That was in conjunction with a doctor's visit and labs.
Yes. You mentioned eye drops. In the beginning, the only thing available was, the over-the-counter eye drops, which I use to this day. Just here's a bottle, and there's a bottle over there, and there's one over on my desk. And several years ago, my ophthalmologist prescribed autologous serum drops. And that's, they draw your blood, they spin it, they take your serum and mix it with a certain percentage. I've had 30%, 40%, I'm up to 50%, and mix it with normal saline and put it in little bitty bottles. And you use that about 4 times a day. And that's been very helpful. Yeah. The first time I ever talked about Tepezza, I started crying because it's like, I never dreamed anything like this would be available. IV steroids were just not used back then. And that's about all I can think of.
All right. Thank you, Nancy.
You're welcome.
So a few additional questions that were asked in the survey. We asked participants if they felt that their health coverage and or insurance and or the cost of treatment in any way limited their medical care for thyroid eye disease. 48% no, 33% said yes, and 19% said they were not sure. We asked, is there a reason that you might not be able to have the TED treatment of your choice? And I'll read some of the narrative responses here. Waiting on insurance to respond. Financial strain due to limited insurance. It's too late now. I have insurance, but the copay costs are astronomical. Lack of easy access. I have to drive 3 hours there and 3 hours back. It's hard for friends to take that much time to spend with me. No one within a 60-mile radius qualifies. Hard to drive with TED. And continued here. Most of these treatments are in the USA. There are a lot of people living outside the USA like me, those who need these treatments too. Limited access to providers with an understanding of what TED is and what treatment options were available. No physician seems to know much about TED. And finally, worried about side effects. We also asked, and I'm going to skip through this pretty quickly, over the past 2 months, which activities have been made easier by medications or orbital radiation? And then we had another question that was specific to surgery. I think the challenge with the way this question was worded is that the intent was to stick to the 2-month period in which people said specific symptoms had affected the quality of their life. But I think the challenge is we don't know when the patients got these different treatment options. So maybe they had orbital radiation 6 months ago, and in the 2 months after they finished the orbital radiation treatments, they had loads of improvement, but in the last 2 months, there hadn't been much improvement. So I'm leaving these percentages up there, but they're probably a little bit low and would have been higher had we asked, have you seen improvement since you've had the treatment, regardless of when that treatment was? And then a reminder that all of this that I'm sharing today, this is strictly raw data. It has not been subjected to any sort of statistical analysis. But I would like to provide a few insights just based on this raw data that came out of the survey. When we looked at our survey group in terms of IV steroids versus oral steroids, and this was consistent with existing literature, IV steroids had a higher percentage of seems better responses versus oral steroids for every single symptom. And I won't read off all of these, but just a couple of highlights. For example, 50% of the IV steroid group said their bulging seems better. That was only 29% for the oral steroid group. 40% of patients who experienced tearing and had IV steroids said that their tearing was better, and that's versus just 20% of the oral steroid group. So of the treatment options that we have discussed today, Tepezza is the newest. It was approved by the FDA in 2020. And for a number of the symptoms, it had the highest percentage of seems better responses out of all the non-surgical options. And so I won't read every single one of these, but I'll give you a couple of examples. For redness, 56% of the patients who tried Tepezza said their redness seems better. The next best non-surgical options were Tide, IV steroids, and eye drops, and 39% of those patients said their redness seems better. For tearing, 56% of the patients who tried Tepezza said their tearing seems better. The next best non-surgical option was IV steroids, and 40% of that group said their tearing seemed better. I'll just breeze quickly through the last few. For inability to close the eyelid, 51% seems better on Tepezza versus 36% IV steroids. For eyelid swelling, 62% seems better with Tepezza versus 48% for orbital radiation. Pressure and pain, 65% said that seems better on Tepezza versus 52% with orbital radiation. For eye bulging, 63% said that seems better with Tepezza versus 50%. And the next best options were tied. That was for IV steroids and for orbital radiation. For light sensitivity, 45% seems better on Tepezza versus 35%. And again, we had a tie between IV steroids and orbital radiation. A few additional notes on Tepezza. We had 51 users who had tried Tepezza, and they were exactly evenly divided between those who said they had active TED, those who said they had inactive TED, and those who were not sure, 17 each. Interestingly, the patients with inactive TED reported higher levels of perceived symptom relief than those with active disease, which is a very interesting thread to pull on, but I think it needs to be interpreted here with some caution. As a reminder, the perception of symptom relief was self-reported. It was not confirmed by a medical examination or medical records. And the other issue is that the survey captured whether the patients were active or inactive at the time they took the survey and not the time of treatment. So it is possible that for these 17 who said they were inactive, perhaps they were active a year ago or 2 years ago when they were treated with Tepezza, but they're inactive now. But again, that was an interesting finding that would be worth some further exploration. Also, our survey didn't ask about relapse on these treatment options, but out of the 51 patients who used Tepezza, we got 13 narrative comments from patients who mentioned that they were either in the process of doing a second round of Tepezza or that they wanted or needed a second round. Out of those 13, 5 patients specifically said they had relapsed after using Tepezza, and that's why they were doing the second round. 5 patients said they were hoping to get further improvement with the second round of Tepezza, and 3 patients didn't specify a reason. So in terms of the surgical options, if you looked across the board, didn't try to parse out by age or activity level or any of these options, the highest level of seems better responses were all surgical. For orbital decompression, 92% said their bulging seems better, 78% said pressure and pain seems better, 75% said their inability to close the eyelid seems better. For strabismus surgery, 83% said double vision seems better, 75% said eyes pointing in different directions seems better. And for eyelid surgery, the inability to close the eyelid, 70% of those who underwent eyelid surgery said that that seems better. Of course, the downside to all of this is that typically patients need to wait until the end of the active phase of thyroid eye disease before they can undergo any of these surgeries. And the one exception to that is emergency orbital decompression can be done if you have compression of the optic nerve and there is an immediate threat to your vision. So pretty good responses with all of these surgical options, but the downside is you have a year, maybe 2 years, maybe 3 years of waiting for that active phase to end before you can get treatment. A few additional insights. As you can see from these numbers, we have a lot of patients that are getting left behind. They're not getting relief from any of these existing options. We had a lot of patients who weren't aware of all of the treatment options that were available. A lot of people, in fact, used the narrative section to tell us this. They said, I don't know what any of these are. And this is really important with a number of clinical trials for thyroid eye disease underway. So it's really important that we get that physician-patient communication going around what all of the available options are. A full third of our participants said that either insurance or health coverage or the cost of treatment had prevented them from getting the treatment that we needed. And actually, my first thought when I saw 1/3 was, wow, I'm surprised it's not even worse. But every single one of these is a patient that didn't get the treatment that they needed, either because of their health insurance, their health coverage, or it just simply costs too much. A few additional insights. Quite a few patients had labs out of range or didn't know their latest lab results. So 31% of the survey group had TSH that was either too high or too low. 20% didn't know at all if their labs were in range. 8% had free T4 that was out of range high, and 5% for free T3 out of range high. 4% reported free T3 or T4 out of range low. And this is really important because there was a consensus statement released by the American Thyroid Association and the European Thyroid Association recently. And one of the points that stresses is the importance of rapid resolution of thyroid dysfunction and then sustained resolution of thyroid dysfunction, making sure that those levels get to the point where they are normal and stable. And this is important to reduce the risk of new onset or worsening thyroid eye disease. A few lessons learned from this project, as Nancy and I talked about in the prior webinar, I wish we would have had a phone option or print option to allow patients with low vision or no internet access to participate. I wish we would have had a survey population that more closely matched the TED population as a whole in terms of age, race and ethnicity, and gender. I wish we would have asked about relapses for all of the treatment options, and I wish we would have asked about smoking status. And that is important because current smokers tend to have more severe TED, and they don't respond as well to the available treatment options. And again, I also wish we would have asked about activity level at the time of treatment. I would have liked to have distinguished between over-the-counter and prescription eye drops. And I would have loved to get the questions more carefully tailored to figure out who the non-responders were and who the relapsed patients were in terms of, age, race and ethnicity, antibody levels, thyroid hormone levels, gender and smoking status, and how that affects perceived success with each treatment option. Of course, the challenge that we had with the survey was it was already 62 questions, and we didn't want it to turn into 150 questions to where nobody had the time or had the stamina to take the whole survey. But hopefully somebody can take these lessons learned and perhaps apply that to a future project. And I'll share a few patient stories as we wrap up, and then we'll bring Nancy back in. I hate it. I wish I knew why I got it. I was pretty before. I had pretty eyes, and now I'm different looking. My specialist doesn't care. It's hard to explain to strangers, life before graves. TED impacts my life daily, both work and home. I've changed careers because of it and had a substantial decrease in salary. I was losing independence fast, and there was nothing to stop it. I am a nurse, and my health was spiraling out of control. The anxiety, panic attacks, brain fog, double vision, change in appearance, headaches, pain in the eyes was taking me away from everything I was and knew. Basically ruined my life, my earning ability, and my independence. It's worse than having breast cancer, which I had 16 years ago. This is a very difficult disease that causes tremendous damage to one's health, ability to be independent, and psychological well-being. As is the case with other autoimmune diseases, it is unpredictable, triggers other significant health problems, and is always with you. So as we wrap up, I wanted to bring Dr. Nancy Hord Patterson back in. And Nancy, do you have any closing thoughts about thyroid eye disease in general, or what our findings were in the survey, or where patients go from here who are seeing this presentation?
I don't know anybody that has been cured from thyroid eye disease, but I don't know everybody. For me, it's still with me. It's manageable. It's aggravating. But I can still laugh when I pour cream into the wrong cup, when I have coffee and things like that. I think you need to make sure you're with a physician who really knows thyroid eye disease. Unfortunately, so many of them, it's beyond their scope of practice, their scope of training. And it's sometimes, if you live in a very small town or a remote town, it's hard to find somebody. So if you can go to, ideally, a university level teaching hospital and get the information you need, they will work as a consultant with your eye doctor so that you don't have to keep going back and forth. There are some things that come along as consequences of having thyroid eye disease. They're not thyroid eye disease. For instance, my muscles are still pretty big and tight. They're back in there, but I've got glaucoma now. And that's not a symptom of thyroid eye disease, but it is a consequence. And I think the other big thing is get support. I think I mentioned earlier, to this day, I have talked to one person who knew who knew what these words meant. You know, oh yeah, I do know somebody with TED, or I do know somebody with Graves. There are ways to find support. The Graves Foundation will help you, but you need to be able to talk to some other people who are experiencing what you are experiencing, because nobody experiences like you what you have going on. Your family experiences it differently. Your caregivers experience it differently. But when we have a conference, I'll say to the whole group, I'll say, everybody in this room has Graves' disease and thyroid eye disease, one way or another. And they go, yeah, I guess we do. But just hang in there. There's a whole lot of good life left. Learn to take care of yourself. Do things that you still can do, or make up some things that you can do now that you'd never thought about doing before. But take care of yourself.
And we were chatting offline about getting credible information as well.
Thank you for the reminder. I even think I told you to remind me. Back when I started the foundation, the internet wasn't really available. When it got available, there were people on there talking about taking bugleweed to cure your Graves' disease. Credible information comes from valid sources. It's not somebody's opinion. It's not somebody's, oh, well, what if we try this? Please don't listen to those. Please listen to your doctor. And again, make sure your doctor knows your condition, because there's just as many endocrinologists that don't really know about Graves' disease, because there's so many other endocrine disorders. And we're considered a rare disease. And those of us that have it really significantly are very, very rare. So get the consultations you need, get the evidence-based information you need. And again, hang in there.
And I would add that, you know, there are credible organizations out there that are providing good information. The Graves' Disease and Thyroid Foundation, the American Thyroid Association, the ASOPRS, who has just changed their name, I believe. I will look that up and add it in the notes to this YouTube presentation. But there are sources out there of credible information, but still it's important to gather all of this and then take it to your own doctor who knows your personal medical history and knows you know, exactly what you're dealing with in terms of your thyroid eye disease, because every patient is unique. But still, there are those credible sources of information out there. Nancy, thank you so much for your time today. This has been excellent. And we'll wrap up this presentation on the other side. All right, thank you so much, Nancy. And as we wrap up, again, a final thank you from the bottom of our hearts to everyone who took the survey and took the time to share your stories with us. Thank you also to our project sponsor, Amgen, to our co-authors on the How Patients Experience Thyroid Eye Disease paper, The first 4 authors on the paper were the clinicians that came up with the original idea to do a TED survey, Dr. Smith, Dr. Hegedus, Dr. Lesser, and Dr. Peros. The final 4 authors on the paper, Michelle, Patty, Laura, and Mukund, were with Rare Life Solutions, and they helped us get this project from the spark of an idea to getting the data collected to producing that original published paper. Thank you so much for watching. If you would like to reach out to the GDATF, you can call us toll-free within the USA and Canada at 877-643-3123. That's 877-643-3123. You can email us at info@gdatf.org. And you can visit our website at www.gdatf.org. Thanks and have a great day.